You're listening to the Future Tech Podcast with Richard Jacobs. Future technologies such as artificial intelligence, stem cells, 3D printing, gene editing, Bitcoin, blockchain, the microbiome, quantum computing, virtual reality, and exploring space are much closer than you might think. In fact, many early versions of these technologies are in play right now, and the companies that are using these technologies are the focus of this podcast. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a thorny medical problem. Remember, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you've enjoyed the podcast, please listen, subscribe, like, and tell your friends about it. Thank you. I spoke to Mark Abramson. So he's a dentist. He focuses on sleep apnea. He also focuses on TMJ. TMJ is a major problem that affects a lot of people. It's pain in the jaw and headaches and all kinds of problems. So the interesting thing is that Mark uses a combination of therapies. So he won't just necessarily do surgery on you or give you muscle relaxers. He'll manipulate your head and your jaw and your cranium, much like a chiropractor or an osteopath would. I think he called it an osteopathic adjustment, to try to relieve muscle tension and things like that. For TMJ, he also has a splint, he calls it, but it's a device I guess you'd insert in your mouth so that your jaw actuates in the right way, and it relieves pain and a lot of TMJ issues. Then the other side of it, in sleep apnea, I didn't know that he developed 2 dental appliances that seem more sophisticated than just pulling your lower jaw forward to prevent apnea. One, I guess, pushes on a certain part of the inside of your mouth that helps your nose open, which is pretty cool. And there's another feature he described that keeps your tongue doing something it's supposed to be doing. But very interesting guy. I want to have him back and talk more about his oral appliances. So those are the takeaways from him as well. So this is Richard Jacobs with the Future Tech and Finding Genius podcast. I have Mark Abramson. He's a TMJ dentist and a sleep apnea dentist. So Mark, thanks for coming.
Thank you. Thank you for having me.
And as I mentioned offline, I've spoken to a lot of people in the sleep apnea and snoring area, but TMJ, I guess that's the temporal mandibular joint. I've heard about TMJ pain, things like that, but I haven't really spoken to any dentists about it. So I guess first a little bit of background on yourself, like, why are you a dentist and why these 2 focuses within dentistry?
Okay, that's actually a pertinent question to my work. Well, I had always an interest in healing and medicine. And when I was a kid at 14 years old, I was hit by a car as a pedestrian. And out of that, I actually created kind of a life attitude and belief system from that experience that was very positive in nature, although the accident itself was quite intense. I really kind of saw the lifestyle of a physician and thought, I want to be let's be a dentist. And my older brother did that before me, so I kind of familiar pathway. But all through school, I had an idea that I wanted to do. I had a sense that working with the body as a whole, rather than being a simple dentist working with teeth. And so when I did my residency, I was very interested in things like meditation and natural healing. And I saw that, the way I was taught about pain, which was just basically writing prescription, was not adequate. And I started looking for alternatives and feeling like that I wanted to dedicate my life to that. So I started looking at things like acupuncture and osteopathic manipulation, cranial therapy, trigger point, the whole nervous system, and then the mind-body connection. So I really saw that working with craniofacial pain, which is kind of the broader subject. TMJ is the joint itself, but there's what we call TMD, which is temporomandibular disorders, which is a whole series of interactions between the jaw and the brain and the muscles of the body. So what I did is I put things together in a way that I saw the tools that would help do the most effective treatment, and I dedicated myself to a non-drug approach. So if I couldn't make the system better and resolve the causes of pain, there's plenty of good prescribers in the world. I kind of avoided the opioid epidemic that way too.
That's great.
And yeah, and so basically what I saw is that the mouth and the jaw is one of the main centers of growth and development, and it's also altered by all kinds of forces of life, whether it's being a mouth breather, having improper tongue swallow, or orthodontics, which was actually the way it was practiced and sometimes still is practiced, is basically detrimental to your overall health. Get nice straight teeth, but you get a compromised airway and pressure in your jaw and lack of tongue space and things like that. Sinuses closed down. So we used to extract teeth and close things down because we said there wasn't enough space. And now we are growing and taking over growth and supporting the healthy growth of kids, which is important. And then the airway, sleep, is intimately interrelated with the mouth and the nose development, facial development. And so things that lead to compromise in breathing and therefore sleep was part of that. And then I also bringing mindfulness into medicine. I founded Stanford's mindfulness-based stress reduction clinic 25 years ago and teach stress meditation at the medical school at Stanford. So basically, these are the pieces that I put together into a treatment program. And you know, always kind of, it's been an evolution for 40 years, over 40 years.
All right, well, let's talk about TMJ and TMD. How do patients present to you? What do they say is bothering them, and then what are some of the ways in which you can help them?
Right. Well, there's a couple of reasons that patients really are most of the time. A lot of times, patients have ear pain, and they go to the ear doctor. It used to be that things were so separated in medicine, you almost had to convince physicians that headaches or ear symptoms were caused by the jaw. Like the jaw's the dentist, and it's like not part of the body. But nowadays, I get so many referrals from ear, nose, and throat doctors because they look in the ear and there's nothing there, and they do a hearing test or whatever they might do, and then they say, well, it's not your ear, it's your jaw. And so the jaw and the ear are conjoined twins. The inflammation of the jaw drains into the ear. The sensitivity of the jaw, which is very powerful nerves, are located primarily throughout the jaw joint, but primarily between the ear and the jaw. And balance can be thrown off. People who have balance problems can be because of the jaw, because neurologically it's in the same pathway as your spine, basically feeling through your body to feel your feet on the ground is on the same circuitry as the jaw. So there's so many interesting interrelationships. So people, headaches, clicking in the jaw is a common reason for concern. So those are the reasons that people come in, mostly headaches, ear pain, jaw pain, facial pain.
So, all right, how can you tell that someone has a TMJ? Like, all right, so let me back up. What causes TMJ pain? What's happening? Is the jaw the different tightness of muscles that are pulling the jaw and the whole face and contorting it, and the skull, or like what's the underlying root of TMJ pain?
Yeah, well, it's not there's no contortion there, but it is muscle. There's two sources of pain. One's local pain, which would be in the jaw, ear area. There can be fullness problems with the eustachian tube from the ear, ringing in the ear, or headaches. So headaches or facial pain, they come from muscles that are being overused, building up what called trigger zones. And these trigger zones are areas of the muscles where you might touch and it would hurt, but it also refers pain to other areas. So often the headache and is a referred pain. You might have a muscle in the neck, actually, that makes you have a headache in your forehead. And so referral is kind of an interesting thing, because where you're feeling the headache is not where it's coming from. So that's part of practice is being a detective and figuring out where things are coming from. But so you have the muscle source, you have direct jaw inflammation, and those are the two things that you kind of really are working with.
Well, how do these problems start, do you think? Is it because, stress, or someone literally sleeping on their side and their jaw gets pushed in a certain direction, or is it the growth of their jaw as they age that tends to favor one direction? Like, how do you think this happens?
It can happen many different ways. It could be growth and development, that there's more stress in the system. The way that the jaw is supported by the teeth determines the pressure in the jaw joint, and therefore against those nerves. So if you have a lack of proper dental alignment, that can eventually wear out the joint and cause inflammation in the joint. You can have a trauma, a sports injury, or something that jars you and kind of tore the ligaments that hold the disc in place. Or you can have, all the bumps and unknown things in life that generally, type of thing that leads to neck and back pain and jaw pain.
Okay, so what would be some of the protocol and how you treat someone they've got this consistent?
Okay, so we evaluate the person, try to figure out what the triggers are, and usually we would make a lower splint that basically adds height to the back teeth and frees up the jaw to go to where it wants to be. So the tightest the jaw is when the teeth are fully together, and when you add a splint, which snaps over a plastic that snaps on and off of the teeth in the lower arch, you hit the plastic before you would hit your natural teeth, and it's also a flat surface that just lets the jaw go to where it's happiest and balanced. So a lot of times the way our bite is like having a shoe that's 2 sizes too small for our feet, and we take the pressure off the ear and the jaw by freeing the jaw up with a splint. And then I do hands-on manipulation, which is an osteopathic approach, sometimes called myofascial release, sometimes called cranial osteopathic manipulation. And that's probably the most important thing, because I'm taking out and relieving the pressures that have built up over the years from wherever they came from, and kind of freeing up the nerves that have been firing because of this pressure, and then doing injections of trigger points. So it's a weekly series. We call it, kind of a spa treatment, because it's actually quite pleasant and relaxing experience. And so that's my approach pretty much. And then if their symptoms are relieved, and if they would go back to their old bite and it would basically set off the same condition, then we have to look at what we call phase 2, which could be orthodontics, Invisalign orthodontics or something like that, to get a better bite with better health for the whole system.
Well, what does the splint do? Does it just prevent the person from biting down and applying pressure at the end of the bite? Or does it alter the way they bite so that their jaw doesn't move in the same tract?
Well, as I said, it frees up the jaw to go to where it wants. So basically, it's like a doorstop that stops the closure at an earlier point without making it hit a certain spot. So your teeth, the way your mountains and valleys hit in your teeth, direct the position forward or back of the jaw. And with a splint, you're stopping earlier and letting the jaw go, usually goes forward on its own, which relieves pressure in the ear.
All right. Well, I'm trying to understand. It's just, I guess, without a visual, it's a little bit difficult. But
yeah, well, if you were in my office, I have a real human skull, and I show if you go online and you look up the TMJ, we can maybe make a link for people, and you see that the jaw is sitting in a fossa, a kind of a garage that is right in front of the ear and the ear canal. And if the head of the jaw, which is a ball and a rod, basically pushes back into that and squeezes those nerves, that's not good. And when it comes forward and opens space for the blood to flow through there and the nerves, then that relieves that pressure. So that's what a splint does, is it allows that pressure to get away from the ear.
Okay.
And that does a lot of things. It does a lot of different things when you do that.
Well, okay, you say it does a lot of different things. So it allows the jaw to move in a better way. So with or without your physical manipulation, like what would someone experience merely if they had a splint only?
Well, we do a lot of patients from Kaiser Health System, and they only let me do the splint, and they pretty much are very happy and feel a lot better. Their headaches go down significantly or go away. Their ear pains away. Sometimes we've actually had a lot of success with people having ringing in their ears or balance problems. So it's a very sensitive system right there, the ear and the jaw, because the temporal bone, which houses both the ear and the jaw, is central to a lot of different the cranial system, the carotid artery and the jugular vein, a lot of different structures there that are part of the temporal bone. Okay. So in osteopathy, it's said that the temporal bone is directly connected to 9 out of 12 of the cranial nerves. So there can be different ways it can impact the cranial nerves.
And if you don't do a splint, but you do the manipulation alone, has that had much of an effect?
Yeah, we can, there's what we're doing is basically we're trying to make the system healthier. If somebody has a poor bite and the pressure from their jaw joint is physically coming in their head, and you just do manipulation, you're not going to get the full result because you haven't addressed the mechanical problem. It's like having a pebble in your shoe. If you don't take the pebble out, you're not going to, massage isn't going to help the foot.
Well, the manipulation, all right, so again, what, in your estimation, what is the root of the problem? The manipulation helps, the splint helps, but how do you train the jaw to move in the right way, I guess, on the regular, so that this doesn't happen again?
Well, I feel like we're trying to get circular with our questions here.
I apologize.
Yeah, my treatment is geared towards figuring out, my skill is looking at evaluating people initially and knowing the components that they need and prescribing those components for them. If it's not like a cafeteria where you pick and choose, if you need a splint, I'm going to play doctor and say, you really need this. And, you always have the option, but informed consent is going to be, my job is to educate you on what I think will be most effective. And so there's, pain is multi-directional stress. Somebody's stressed, and that aggravates anything that's going on. So you can have a physical problem that's aggravated by stress. You have, multi-directional input that tax you in different ways. It can tax you physically, it can tax you mentally and emotionally, and it can tax you, through your nervous system. So my job is to have the tools to direct people, whether I do it or not, or refer them, that we're going to, help them where they're needed.
Well, what kind of people tend to have TMJ problems? Does it affect people of a certain age, or more women or men more? I mean,
well, it actually affects women more. Probably about 80%. They have looser ligaments, number one, plus what was recently discovered. So in the old days, we used to use this derogatory term that I used to hear in medicine, which really I didn't like at all, was it's histrionic women. I mean, that's, it's just all in their heads. It turns out that the pain receptors are estrogenic receptors, and women experience this type of pain much more significantly and severely than men do. So they're having, because of their biology and their estrogen receptors, they're having much more inflammation and much more pain in the same condition. Plus they're looser ligament-wise, which their disc and their tissue can be less stable. So that's the main thing, and it happens as people get older, having this, if you live with this for so long and you suffer for so long. The only good news is that your body's remodeling and gradually kind of creates arthritic changes that relieve the pressure in the bone. They're not healthy, but it does relieve the pressure in the bone. So younger people and women are the most prominent people that will be seeing this. And it's kind of like the other part of my practice, which is sleep apnea, is like a greater percentage of men. So it kind of balances out the practice.
Yeah. How long have people had pain or problems before they come to see you on average?
Well, everybody's different that way. Some people come right away and they're proactive, and some people put up with it until it's I can't take it anymore.
Oh, I didn't know if on average it's years or people are pretty quick to take care of it, but I guess you're saying it's just variable depending on the person.
Well, the biggest issue actually is that people are running around to different doctors, neurologists, ENT doctors. They're internists and not getting directed correctly, to begin with. So that's really, part of it is the person recognize it within themselves, seeking help, and the helpers being able to be directive. And the problem is that I usually will see patients after they've literally run through the medical system through various specialists, had all these, have some of them come in, they've had MRIs and CTs and hearing tests, and it's like the medical resources that could have been saved by recognizing this right away, to me, is often kind of wishful thinking, and that it could be better.
Yeah. Do people think that a dentist would handle this kind of thing, or like what would be their go-to thought process, or a primary care physician? Would they think it's a dentist that can help?
Well, if it's their jaw joint, they might think of their dentist, or they're seeing their dentist more regularly, their physician often, and they can mention that. And the dentist, makes a referral or addresses it themselves, tries to address it themselves. But a lot of times, as I said, it depends on their complaint, but it's kind of, when you go into medicine, it's let's rule this out. So they're ruling out, brain tumors and all kinds of other things. And at the very end, then they might say, oh, it's not any of these. Then it's your jaw. So it's just the medical system itself could be more efficient.
All right, I guess that makes sense. And then, we can just briefly just touch on apnea. Do you typically see patients and then they end up with an oral appliance, or when they have apnea?
Actually, I invented two of the oral appliances on the market.
Really?
So yeah, so they're called the Oasys and Oasys hinge appliance, and it's the only appliance in the market that helps the nasal breathing. It's a nasal dilator and helps nasal resistance, as well as opens the back of the throat and retrains the tongue to get the throat stronger. So it has three components of action, where all the other appliances just basically thrust the jaw forward to open the back of the throat.
Oh, okay. Yeah, I pulled up a picture of it. Oh, wow. So, okay, if you don't mind just restating that. So most appliances will just thrust the lower jaw forward, but yours, in addition, tell me again what it does?
Yeah, in addition to that, it opens the nose, dilates the nose from inside the mouth. So I figured out a way to do that, to stretch what's called the nasal valve open from inside the mouth. And then it also has pads that go under the tongue into a space under the tongue, so you don't really feel it, but it doesn't allow you to make a shortcut and be lazy with your throat. So it basically retrains your throat. We use it for kids for speech therapy and for tongue thrust patterns, to re-educate people to use their throat better, which is a common problem, like people who lisp and kids who have speech problems. We can correct that with those pads that we target. That what I did is basically with the nose and the throat is figure out two good targets.
Oh, wow. Yeah, okay. So there's these pads that push from the inside of your mouth against an area of, I guess, in the mouth, it's the upper part, the upper front part of your mouth, above and behind the teeth.
Yeah. There's the fold that you have from the kind of corner of your nose down to the corner of your lips. That's called the nasolabial fold. And that crease there, if you stretch both sides of that, you'll feel it's easier to breathe through your nose. if you just stretch them laterally.
Huh.
And that's what we do from inside the mouth. And it drains. There also happens to be acupuncture points that drain the nose. So we drain the sinuses and help people breathe through their nose easily.
Wow.
All night long.
That's important because, yeah, I've noticed, like, if my nose is stuffed up or sometimes it's just swollen, it kills my sleep. It's horrible. And it seems like it's a big backup system for breathing.
Right. Well, if you think of the face, God, what's the swimmer who won 20-some gold medals?
Michael Phelps.
Phelps, yeah. So if you look at Phelps, Phelps is never breathed through his nose in his life. In some ways, it's an advantage for a swimmer, but that's growth and development. You see, he has a very narrow. If you look at a picture of him, he has very narrow mid-face, and his lips, his lips are always apart, for where he's breathing through his mouth. And people breathe through their mouth, their lower lip is really dry and crusty. They can never keep it moist. And their throat is being battered all the time. Well, it turns out he's a great swimmer, but also he's recently reported that he has ADHD and he has anxiety and depression. And, these are these come from breathing disorders. So, the way that we're using our face and our throat, you don't like it because you're a nasal breather routinely. And if you had to breathe through your mouth, you hate it. And so would I. But some people do it all the time and they don't realize what it's doing to them and how that's affected them. So breathing is critical with the way you breathe diaphragmatically. I can send you a link to share with people of a talk I did for Stanford, for all the corporations here. It's called Stanford Corporate Partners, on the research on stress and breathing and how it affects, how it affects you. So it's a YouTube video that people can you can link them to.
Yeah, if you wouldn't mind. Sounds like I definitely need to, if you're willing, to have you back for the specifically for the oral appliance stuff, especially because you're the inventor of two kinds, and it's a lot more complicated than I thought. Huh.
Sure.
Yeah, that's very cool. For now, what's the best way for people to find out more from you and to get in touch?
Right. Well, my office is in Redwood City, California. My website is, we can get a link to my website for my office, and then for the sleep apnea, we have a website called Oasys, OASYS, sleep.com, and we can get a link for that, which is about the sleep apnea devices.
Okay.
And our lab, if people are in different parts of the country, we can connect you with people who do with our appliances.
Yeah, that's great. Well, if I can, I'll call you Dr. Mark, I guess, this version of calling you your name. And I appreciate you coming on the podcast. Thank you.
You're welcome. Thank you. Have a good day, everybody.
You're listening to the Future Tech Podcast with Richard Jacobs. Future technologies such as artificial intelligence, stem cells, 3D printing, gene editing, Bitcoin, blockchain, the microbiome, quantum computing, virtual reality, and exploring space are much closer than you might think. In fact, many early versions of these technologies are in play right now, and the companies that are using these technologies are the focus of this podcast. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a thorny medical problem. Remember, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you enjoyed the podcast, please listen, subscribe, like, and tell your friends about it. Thank you.